I'm going to start this lecture basically with a brief introduction. Then I'm going to just talk a little bit about diabetes, cardiovascular disease, radiation therapy, chemotherapy and bone disease, organ transplant, give you some recommendations, some take-home message, and the future of where we're going with the management of the medically compromised patients. Now, the thing is, I'm going to go briefly on these topics because I cannot cover every single disease in medically compromised patients. But I'm just going to talk a little bit about evidence related to these conditions. If we look at the quality of evidence, we have the highest quality in systemic reviews and critically appraised topics and articles. And as we go down to randomized clinical trials, cohort studies, case-controlled studies, and background information and expert opinion, we have different levels of evidence, and these different levels are translated into levels 1 to 5, where 5 is expert opinion, and when we go to 1A, we're looking at systemic reviews. And based on these, we can go into different grade of recommendations from A, B, C, and D. Now, what we would like to see is level 1, and that's the highest level of evidence we can look into, basically based on randomized controlled trials and meta-analyses of randomized clinical trials. Now, if we look mostly at the literature related to management of medically compromised patients, basically, this is one article that talks about failures related to associated risk factors. This is a retrospective cohort study that was followed longitudinally over time, and it represents level 3 in the levels I've just showed you. And if we look at this slide, we look at the red dots, and what they noticed in the study, higher failure rates in smokers, and that would be 1.5 times. In diabetic patients, which is around 3 times. Patients who received radiation therapy, and these are patients with head and neck cancer, which is 2.5 times.